Hi, I'm Congressman John Boehner. First, let me thank the YouTube community for submitting some very thoughtful questions and comments. My colleagues and I believe the best ideas come from you, not from bureaucrats here in Washington. This effort is just one more example of that. And before I get into your questions, I want to also make sure that you know this isn't the only chance you have to weigh in on the issues that are important to you and your family. Visit gopleader.gov to send me a message or a follow and reply to GOP Leader on Twitter. With your help, direct media is making government more transparent and accountable. Forward this video to your friends, and let's work together to make sure Washington listens to the people. The first submission is from Blinn in Illinois. Blinn says, all people voting on these bills should be required to personally read the entire bill before being allowed to vote on it. It's ridiculous that these bills are thousands of pages long. Bills should be written in clear language. Blinn, Americans have the right to know what's in these massive bills before Congress votes on them. And if I become Speaker of the House, we're going to run the House differently from the current majority and from past Republican ones. And if I become Speaker, there'll be a 72-hour reading period required before any bill is brought to the floor. It's part of our Congressional Transparency Initiative. You can check it out at gopleader.gov/read the bill. But in addition to that, we don't need to have these really big bills. We can keep these bills smaller, more targeted, and so that people actually can read them and understand what they're voting on before they come to the floor. Next, C. Rogers from Lincoln, Nebraska asked, why not quit artificially eliminating the market? Stop tying health insurance to employers and increase the market dramatically. Allow insurance providers to sell across state lines and increase it even more. The larger the market, the lower the price. This is really one of the centerpieces of our Republican health care proposal. Marsha Blackburn talked about it today at the summit. Democrats claim that they've included it in their bill, but they really haven't. What they really are trying to do is to say, well, we've got the same thing buying across straight lines, but only if you go to a government-run exchange with a government-mandated health insurance policy that's going to be designed by the government as well. Republicans believe you ought to be able to buy any insurance policy across state lines, and you can decide for yourself if that policy fits the needs for you and your family. Up next, we've got Pat from Chicago who asked, Thompson Reuters had performed a study in which they concluded that 40% of healthcare waste was from unnecessary care. Unnecessary care is primarily a result of a fear of being sued, AAK, malpractice. What's being done to address malpractice? Well, Pat, you heard today that medical malpractice is really important. And it's not just that we reform this so that we're not driving doctors out of states and out of communities. It's also because of the defensive medicine that doctors practice. You know, it was brought up today a number of times, but we never really got into the numbers. The Congressional Budget Office says that we would save $54 billion over the next 10 years in the government-run programs if we had medical malpractice reform. PricewaterhouseCoopers issued a report in 2006 that said we would save up to $125 billion over the next 10 years. And then we've got other reports. But one that came out was a Gallup study that was done just 6 weeks ago. And they interviewed doctors all across the country, and doctors claim, a majority of doctors claimed, that 26% of the care they give is defensive medicine. We know that we can eliminate all this defensive medicine that's going on, that we can dramatically lower the cost of health insurance around the country. Brian, a student, asked, do you believe that health care is a right or that health insurance is a right? We all know that if you have a health care emergency in America, you have a right to be treated. It's as clear as that. Health insurance, I'm not quite sure I would call it a right, but we would clearly like to make health insurance affordable for more Americans. And the way to do that is to drive down cost in the current system. You know, I believe that freedom is a right. And any health care bill that takes away Americans' freedom is wrong. I think Americans should have the freedom to choose their own health care, and the government shouldn't choose it for them. Finally, the number one question based on your votes comes from Chris at the University of Florida. Chris says, What is the explicit reasoning behind mandating the purchase of health care services? Well, Chris, liberals believe mandating health care coverage will lower cost. I believe that mandating coverage like this for everyone is unconstitutional. And I think there are better things that we can do to lower the cost of health care and make it more affordable for all Americans. Well, that's the last of the questions. But this conversation on health care is far from over. Visit GOPleader.gov and reply to me via Twitter at GOPleader. And thanks for watching.